introduce you to a remote patient monitoring solution. The system is composed out from several components. The crucial components of our system, the heart of the system is a gateway that is deployed between the patient home, and it's enable the communications of various medical devices and connect these devices through the gateway with the electronic health record system, a system that every healthcare provider is using in order to manage their patients digitally. I have an instance of electronic health record system, but you can envision here any commercial electronic health record system that your healthcare organization is using, as long as it's enabling us a RESTful API or can communicate with HL7, our solution is flexible enough to integrate with it. So we can envision here, for example, Epic or Allscripts. On the left side, you see an instance of our management application that is intended for hospital IT personnel. That application allows to monitor the health of these devices and also provision some of these medical devices to that gateway to allow secure and proper communications to enable patients to use only these devices that we want. I have here several devices. These devices can be different. This is just for the sake of this particular demo. It's a subset of medical IoT devices. I brought with me thermometer, pulse oximeter, blood pressure meter, and scale. These devices are easy to use, but you can envision also devices that can measure the level of sugar in the blood and things like that, and so on and so on. I would like to demonstrate really quickly how the solution is working. So I will start with the management application that is intended for hospital IT personnel. So I will log in really quick to these applications, and I have this gateway. That is a list of gateway that that system is currently using. The one that I brought into this presentation is this particular one. So I'm getting into details of this gateway, and I can learn right away that gateway has been provisioned with several devices. Of course, if I go into edit mode, I can add and provision more devices, but for sake of this demo, I have 4. You see that I also have some indicators about the health of these devices. So you see 30% of a battery means that maybe I need to take an action and change the battery on it. So I have this information between our hospital IT system. Next to me is the electronic health record system. As you see, this system is intended for doctors to see the results of these patient measures. Doctors do not need to see anything about the health of the devices, any technical stuff that is intended for hospital IT, and vice versa. Hospital IT, there is no need for them to see patients' results, right? So we're splitting these two things. Let me play with the system really quickly. So I will use this mobile app. This is an interface for patients that allows to verify the status of the measures and confirm whenever it works, and so on and so on. It's designed to support multiple different patients. So I will use the patient ID card that I prepared. I will scan it. At this moment, I will log into this particular patient's Jordan, and you see the same patients that we're using in electronic health record system, right? We will start with temperature. So it's super easy to do the measure. I will just enable the thermometer and quickly take the measure. And I have 36.5, and right away 36.5 appeared in here, and also 36.5 appeared in this particular application as well. The second demonstrations I would like to do with the pulse oximeter, it's enough to put that on my finger and wait until it's reporting some measures, right? So you see now it's 98, oxygen saturation is 82 on a pulse, and I should see the same results as on the screen, kind of in here, right? So that's basically how easy it is for users to interact with the system. You can envision this mobile app to provide more features. You can, for example, take a pill reminders, or you can have patients to do subjective scores of their health status. I have a headache, I have muscle pains, etc. You can also envision this app to enable the channel for communications with the doctor. It can even enable calls with the medical specialists, and so on and so on. The data that you see on the tablet is also saved in the electronic health record system. So with the solution, we're eliminating all of the human errors. All of the right readings are sent directly into electronic health record system. So medical personnel can have a judgment on these results based on their experience, and all of that is trusted, secured. Patients' data are secured from from the moment when the measurement is taken all the way up to electronic health record system.